You know that feeling. You have been sitting for a while, maybe reading, maybe watching television, maybe just resting, and you stand up and for a moment, everything goes. The room tilts. Your vision darkens at the edges or goes briefly white. Your legs feel uncertain beneath you. You reach for the arm of the chair or the wall beside you, and you stand very still, waiting for it to pass. And after a few seconds, it does pass, and you carry on, and you tell yourself, that happens sometimes. That is just what happens when you stand up too fast. And maybe it does happen sometimes for most people at any age. Standing up quickly can occasionally cause a brief head rush. But if this is happening to you regularly, if it happens most times you stand, if it has been getting more frequent or more severe, or if it has ever caused you to stumble or grab for support or come close to falling, then I want to talk to you today about what is actually happening in those seconds when you stand and the room goes wrong, because this is not simply standing up too fast, and it is not simply part of getting older. There are specific reasons why this happens, reasons that have names, and reasons that your doctor needs to know about. Because this symptom in people over 70 is one of the most underreported and most consequential contributors to falls and fall-related injury in older adults. I am Dr. Daniel Chen, and today I want to explain exactly what is happening inside your cardiovascular system in those few seconds after you stand up, why it becomes more common and more pronounced after 70, what the different causes are, and what you and your doctor can do about it. So let us start with the physiology, because understanding what should happen when you stand up helps you understand what is going wrong, when it does not work properly, when you are sitting or lying down. Blood is relatively evenly distributed throughout your body. Your heart is pumping, your blood pressure is maintained, and your brain is receiving a steady and adequate supply of oxygenated blood. Now, the moment you stand up, something significant changes. Gravity. The moment you move from sitting to standing, gravity acts on the blood in your body and pulls it downward toward your legs and feet. In the space of just a few seconds, approximately 300 to 800 milliliters of blood, which is roughly 1 to 3 cups, shifts from your upper body down into the blood vessels of your legs and abdomen. That is a significant and sudden redistribution of your total blood volume. And the moment that happens, less blood is returning to your heart. Your heart has less to pump, blood pressure begins to fall, and the brain, which is now the highest point in your body, and which is the organ most sensitive to changes in blood pressure, begins to receive less blood. For a brief moment, in a healthy younger adult, this drop is detected and corrected almost instantly by a system called the baroreflex. The baroreflex is a rapid automatic feedback system that detects changes in blood pressure through specialized pressure sensors called baroreceptors, located in the walls of major blood vessels, including the aorta and the carotid arteries. When blood pressure drops as you stand, these baroreceptors detect the drop and send a signal through the autonomic nervous system that controls heart rate, blood pressure, and other functions without you having to think about it. The signal triggers 3 rapid responses. First, the heart rate increases to pump blood faster. Second, the blood vessels in the legs and abdomen constrict, squeezing the blood back upward toward the heart and brain. Third, the force of each heartbeat increases, pushing more blood out with each contraction together. These 3 responses restore blood pressure and restore adequate blood flow to the brain, usually within about 30 seconds. And in a young, healthy adult, this entire compensation happens so quickly and so efficiently that the person feels nothing. They stand up and their cardiovascular system adjusts without a single moment of dizziness, without a single moment of visual darkening, without a single moment of feeling uncertain on their feet. But here is what changes after 70. And here is why this compensation that works so seamlessly in younger adults begins to fail, or slow, or become incomplete in older adults. The first change is in the baroreceptors themselves, the pressure sensors that detect the blood pressure drop and trigger the corrective response with age. The sensitivity of these baroreceptors decreases. They become less responsive, less accurate, less quick. The signal they send when blood pressure drops on standing is weaker or delayed, which means the corrective response also starts later and is weaker than it should be. This is called baroreflex impairment, and it is a normal and progressive part of cardiovascular aging. that begins earlier than most people realize. The second change is in the blood vessels themselves, the blood vessels in the legs and abdomen that are supposed to constrict rapidly when you stand to squeeze blood back upward, become less elastic and less responsive. With age, their ability to constrict quickly in response to the nervous system signal diminishes, which means blood pools more easily in the lower body when you stand and is slower to be pushed back toward the heart. The third change is in the heart itself. The heart's ability to increase its rate rapidly in response to the signal from the autonomic nervous system also decreases with age. In younger adults, heart rate can increase within a second or two of the baroreflex signal. In older adults, that response is slower and the magnitude of the increase is often smaller. All three of these changes together mean that when an older adult stands up, the blood pressure drops as gravity pulls blood downward, but the corrective mechanisms that should restore pressure within seconds are slower, weaker, and less complete. The result is a period of reduced blood pressure and reduced blood flow to the brain that lasts longer than it should, and that is felt as dizziness, lightheadedness, visual changes, or a sense of unsteadiness. This condition has a name. It is called orthostatic hypotension. Orthostatic means related to the upright position, and hypotension means low blood pressure. The medical definition of orthostatic hypotension is a drop in systolic blood pressure of at least 20 millimeters of mercury, or a drop in diastolic blood pressure of at least 10 millimeters of mercury within 3 minutes of standing. And it is significantly more common than most people realize. Research suggests that orthostatic hypotension affects approximately 20% of adults over 65 and up to 30% of adults over 75, making it one of the most prevalent and one of the most clinically significant cardiovascular conditions in older adults that most patients and many doctors do not discuss enough. Now, let me talk about why this matters so much. Beyond just the uncomfortable dizziness itself, because the consequences of orthostatic hypotension go well beyond a few seconds of feeling unsteady. The most immediate consequence is fall risk. When blood pressure drops on standing and the brain is briefly underperfused, judgment, coordination, and reaction time are all temporarily impaired at the exact moment when the body needs them most. To stabilize a standing position, research has consistently shown that orthostatic hypotension is an independent risk factor for falls in older adults. A fall caused by orthostatic hypotension tends to happen in the first few seconds of standing, before the person has had a chance to stabilize themselves or reach for support, which means these falls often happen before the person even realizes that their blood pressure has dropped. The second consequence is the cardiovascular impact over time. Repeated episodes of blood pressure dropping significantly on standing can stress the cardiovascular system. Research has linked chronic orthostatic hypotension with an increased risk of cardiovascular events, including heart attack and stroke, particularly in adults over 65 with existing cardiovascular disease. The third consequence is cognitive. The brain depends on a consistent and adequate supply of blood to function properly. Repeated brief episodes of reduced brain blood flow may over time contribute to cognitive changes. Research has investigated the association between chronic orthostatic hypotension and cognitive decline in older adults. And while causality is complex, the association is there and is a reason why this symptom deserves clinical attention rather than dismissal. Now I want to talk about something that is critically important and that many older adults and many doctors do not appreciate fully, and that is the role of medications in causing or worsening orthostatic hypotension after 70. Many of the most commonly prescribed medications in older adults can cause or significantly worsen the drop in blood pressure on standing. Blood pressure medications, particularly diuretics, alpha blockers like tamsulosin, which is commonly prescribed for enlarged prostate, and ACE inhibitors and ARBs, all reduce blood pressure, which is their intended effect. But in older adults whose baroreflex is already impaired, this additional blood pressure reduction can tip the balance, from manageable postural adjustment to significant dizziness and fall risk. On standing, medications for Parkinson's disease, including levodopa and dopamine agonists, are well known to cause orthostatic hypotension as a direct pharmacological effect. Certain antidepressants, particularly tricyclic antidepressants, and some alpha-blocking antidepressants like mirtazapine, can cause significant orthostatic hypotension in older adults. Medications for an enlarged prostate, called alpha blockers, relax the smooth muscle not just in the prostate, but also in blood vessel walls throughout the body. This generalized relaxation can cause a significant drop in blood pressure on standing, particularly when the medication is first started, or when the dose is increased. And certain heart medications, including beta blockers and calcium channel blockers, reduce the heart's ability to increase its rate in response to the baroreflex signal, which is exactly the compensatory response. That is supposed to protect blood pressure on standing. I want to be completely clear. I am not telling you to stop any of these medications. Every one of them may be necessary and important for your health. But if you are experiencing dizziness on standing and you are taking any of these medications, your doctor needs to know. Because in many cases, a simple timing change, a dose adjustment, or a switch to an alternative medication can make a significant difference to how you feel when you stand up. Now let me also talk about dehydration, because it is one of the most common and most correctable contributing factors to orthostatic hypotension in older adults, and it is very often overlooked. Total blood volume, the amount of blood in your circulatory system, is partly determined by your hydration status. When you are well hydrated, blood volume is adequate. And when blood pools briefly in the lower body on standing, there is enough total volume for the heart to still pump adequately to the brain during the adjustment period. But when you are dehydrated, blood volume is reduced to begin with. So the drop in effective circulation when blood pools in the legs on standing is more significant and more likely to cause symptoms. After 70, as I have mentioned before, the sensation of thirst decreases. Many older adults are mildly dehydrated through much of the day without feeling thirsty, without realizing it. And that mild chronic background dehydration is a consistent and correctable contributor to dizziness on standing for many older adults. Now let me also briefly mention two other conditions that can present with dizziness on standing and that are worth being aware of. The first is postprandial hypotension. This is a drop in blood pressure that occurs after eating a meal, rather than specifically on standing, after a meal. Significant blood flow is directed to the digestive system to support digestion. In younger adults, the cardiovascular system compensates easily, but in older adults with impaired baroreflex, this post-meal blood flow shift can cause a significant drop in blood pressure for 1 to 2 hours after eating, leading to dizziness, lightheadedness, and an increased fall risk in that post-meal window. If you regularly feel dizzy or unsteady in the hour or two after meals, this may be a separate but related phenomenon worth discussing with your doctor. The second condition is vasovagal syncope. This is a sudden and more complete drop in blood pressure and heart rate, triggered by specific stimuli such as pain, emotional stress, prolonged standing, or even heat. Vasovagal syncope can cause not just dizziness, but brief loss of consciousness. Fainting. If you have ever actually fainted or come very close to fainting, rather than just felt dizzy, that warrants a proper medical evaluation. To distinguish vasovagal syncope from other causes of loss of consciousness, some of which are more serious. Now let me talk about what you can actually do, starting today, to reduce the frequency and severity of dizziness on standing. The first thing, and the simplest, is to change how you stand up. Rather than standing up quickly in one movement, pause at each stage of the transition. Sit on the edge of the bed or chair for a moment before standing. Let your legs hang down. The simple act of sitting upright with your legs dependent before standing begins the process of blood pooling in the legs and gives the baroreflex a head start in initiating the compensatory response. Before you add the full challenge of standing, then stand, but stand slowly and hold on to something, a bedpost, the arm of a chair, a wall. For the first few seconds after standing, Give your cardiovascular system the few extra seconds it needs to complete its adjustment before you trust your legs to carry you without support. This single habit change, done consistently every time you stand, can significantly reduce fall risk from orthostatic hypotension. The second thing is to prioritize hydration. Aim for 6 to 8 glasses of water, spread throughout the day, not all at once, spread throughout the day. And if you know that a particular time of day is when you most often feel dizzy on standing, make sure you have had adequate fluid intake in the hour or two before that time. The third thing is to be particularly careful in 3 specific situations that are high-risk moments for orthostatic hypotension in older adults. The first is first thing in the morning after lying down all night. The shift from horizontal to vertical after many hours of lying flat is the most extreme postural change of the day. Take your time, sit on the edge of the bed before standing every single morning without exception. The second high-risk moment is after a hot bath or shower. Heat causes blood vessels to dilate throughout the body, including in the legs. This dilation increases blood pooling when you stand. Stand up slowly after bathing and hold on to a grab rail if one is available. The third high-risk moment is after a meal, particularly a large meal for the reasons I described. When discussing postprandial hypotension, avoid sudden standing immediately after eating and rest quietly for a short period after larger meals. The fourth thing is to discuss the possibility of compression stockings with your doctor. Compression stockings, which apply gentle graduated pressure to the legs and feet, reduce the amount of blood that pools in the leg veins when you stand by physically squeezing those veins and supporting the return of blood back toward the heart. They are not a glamorous solution, but they have genuine clinical evidence for reducing orthostatic hypotension symptoms in older adults, and they are a simple and non-medication approach worth asking about. The fifth thing is the most important. Have a real conversation with your doctor about this symptom. Do not dismiss it. Do not assume it is just aging. Tell your doctor specifically how often it happens, how severe it gets, whether it has caused you to stumble or grab for support, and ask them to check whether any of your current medications could be contributing, whether a lying and standing blood pressure measurement has ever been done. This involves measuring blood pressure while lying down, and then measuring it again immediately on stand. And after 1 and 3 minutes of standing, this simple test can confirm whether you have orthostatic hypotension and how significant the drop is, and ask whether any adjustments to your medications, your diet, or your daily routine are appropriate for your specific situation. You have the right to that conversation, and you deserve that assessment. Let me bring everything together for you now. When you stand up, gravity pulls blood downward into your legs and abdomen. A pressure-sensing system called the baroreflex detects the resulting blood pressure drop and triggers rapid compensatory responses, heart rate increase, blood vessel constriction, stronger heartbeats. In younger adults, this compensation is fast and complete and produces no symptoms. But after 70, the baroreceptors become less sensitive. The blood vessels respond more slowly, and the heart rate response is smaller. This means the blood pressure drop when you stand lasts longer and is more pronounced than it should be. This is orthostatic hypotension, and it affects approximately 20% of adults over 65 and up to 30% of adults over 75. Many medications, including blood pressure medications, diuretics, alpha blockers for the prostate, certain antidepressants, and certain heart medications, can worsen it significantly. Dehydration is a common and correctable contributing factor. The practical steps are: stand up slowly, in stages, prioritize consistent hydration throughout the day, be especially careful in the morning, after bathing, and after meals. Ask your doctor about compression stockings, and most importantly, tell your doctor this is happening. Ask for a lying and standing blood pressure measurement. Ask for a medication review, and ask what changes are appropriate for you. You have been dismissing this symptom as just standing up too fast for long enough. It deserves a real conversation. And now you know exactly how to start it. I am Dr. Daniel Chen. If this video explains something that you have been experiencing but never fully understood, please share it with someone over 70 who also reaches for the wall. Every time they stand up, it might be exactly the information that prompts them to mention it to their doctor before it causes a fall. Subscribe to this channel for weekly videos made with genuine care for older adults who deserve real answers, and leave me a comment below. Tell me how long this has been happening to you and whether you have ever mentioned it to your doctor. I read every single comment, and I genuinely look forward to hearing from you. Take care of yourself and stand up slowly, starting today.